Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And this is a time of the year, of course we don't like to time date the shows, but it does remind me that not only are we to have blessings and good times, but we're supposed to be eating properly. But we're supposed to be eating properly all year round. So I thought that we would bring you a show about nutrition. And so we have two experts here. We have Carla Duenas, who is a registered dietitian. And we got a lot of acronyms after your name, and you'll tell us. But both of you are from Baptist Health of South Florida, and you're part of their community health team. So welcome, Carla.
Thank you very much.
Can I call you Carla?
Yes, of course. Happy to be here.
Okay. And Lucette Telemas. Lucette, who has a beautiful French name. We just decided that it's a beautiful French name. And we welcome you too. You're also a registered dietitian and other acronyms. So tell us what the other acronyms are.
Thank you. Happy to be here. Well, the RD stands for Registered Dietitian or Registered Dietitian Nutritionist. So it just means that we went through specific schooling and then dietetic internship, which is supervised practice, and then passed the national examination for registration to be a registered dietitian. And the LDN is the state licensure in Florida, so we're licensed dietitians in Florida.
Right. Well, I think it's very important for people to recognize that not only because we have the greatest number of people here that are living over the age of 65, but we have the greatest number of people living over the age of 80 in the state of Florida. And one of the reasons why I asked both of you to be here is not only to ask you to talk about that which you do in the community all the time, but most of our viewers have been asking questions about eating properly. Now, you'll have to decide what eating properly is all about. So we're going to start with you, Carla.
Of course. Whenever anybody asks me, what is healthy eating? How do I eat healthy? I always bring up my plate. And actually, I have a little model in here with me. This is the recommendation of the 5 food groups that we should be eating. So as you can see, we have fruits, vegetables, that makes up half of the plate, which takes some people surprised because we tend to fill our plate with the grain group, so the rice, the pasta, or maybe a lot of protein, when in reality, these 2 groups should be just 25% each. And the dairy group, 3 servings a day. This is how we should be eating at every single meal, which is, to me, a great tool to take with you on a daily basis. If you're eating in your house, this is how you can serve your plate. If you're eating in a restaurant, making sure that you're ordering a salad that makes up at least half of your meal, or going to a friend's house or family house, you can always build your plate like this. So this is healthy eating, including all 5 food groups in proportions. Some people can be a little worried about the size of these, and that's a concern that I've heard, but I like to focus more on the proportion. It doesn't matter if their needs are actually double carbohydrates because they're very active, as long as there's fruits and vegetables servings is half of that meal. So the proportion is very important.
Okay. And Lucette, with reference to the little show and tell plate that we have there, when you are visiting these various groups or in your outreach program, tell me the structure of Baptist Health's community health unit, which you both work in, and then let's know who you talk to.
Sure. So our community health department, we reach the Dade and Broward communities and even more into Monroe as well. And we mainly focus on community education programming. There's also exercise classes available to the community. The interesting thing about our programs is that they're all free and open to the community. So obviously as dietitians, we're responsible for the nutrition programming that comes from the department, everything from a lot of planning and working with our partners at Baptist Health to meet the needs of our community throughout Dade and Broward mostly. There's also community events such as big health fairs where there's screenings involved.
Carla, you were going to say?
I was going to add that some of our topics range from just healthy eating to managing chronic diseases like diabetes or heart health. So eating healthy for the heart is a popular class that we have. controlling the blood glucose through nutrition is another popular class, and weight management. That's where we have, I would say, most of our participants coming up is learning how to maintain weight or lose weight.
Okay, well, let's get into some of the detail here. Our viewers have been, this is really their show, so a lot of the ideas that we have and why we asked you to be here is because people out there ask questions. As you both probably recognize, that we have a situation that is not only an epidemic, but it's endemic in the United States, and that is obesity. Mm-hmm. And I know that there are various reasons for that, but in many cases there are really only 2 or 3 reasons, which you're going to talk about, because the people who usually talk to us after an event. In other words, after they have diabetes, after they have a cardiovascular event, something of that nature. But I think that it's imperative that we talk to not only those people who have these morbidities, but more importantly, to the younger people who think that they are almost, they live in a state of omnipresence. Nothing's going to happen to me. Everything's going to be all right. Makes no difference what I eat, how much I eat, when I eat it, etc. So let's get into that topic. Go ahead.
Of course. I think one of the biggest tools, the best tools that we have to shock the audience is visuals. So one of the things that we like to do, especially in summer camps with kids, the younger population, we bring out cans of different sodas, sugar drinks, sodas, juices, things like that. And we bring out a teaspoon and sugar. And we have them actually count out how many teaspoons of sugar each can has, guessing or counting it out. And that gets them excited and they understand why it's so important. Another thing is when it comes to weight management, we bring out a pound of fat, which I have right here with me. This is what actually 1 pound of fat looks like. And so when somebody's saying, oh, I just lost 1 pound, just lost 2 pounds, I'm not being successful, you put this on the table and they're shocked because it is a lot. It's significant. It's a significant amount of weight loss. And now going into the holidays, this is research shows that this is the average weight gain that the American goes through during the holidays, 1 to 2 pounds of weight. So it's just a great visual tool for them to really understand the importance. And then once you have their attention, they're shocked, they relate to it, then they're more receptive to learning, how do I become healthier? How do I prevent this weight gain or diabetes? And so that's how we go about prevention of these diseases.
Lucette, there are special seminars, I would assume, or groups when you talk about, as Carla said, that you have a group that talks about diabetes and cardiac health. Let's talk a bit about that. Go ahead.
Sure. So as you had mentioned as well, we may look at age, and younger generations may not think right now about sicknesses, but prevention is a big word right now being used in healthcare because we know preventing diseases is probably the best thing to do for our health. And nutrition does play a key role in preventing many chronic illnesses that we face now. Not just with prevention, but also early diagnosis. You know, like Carla had mentioned, diabetes. We know pre-diabetes is also another significant issue going on. And, you know, early intervention, we hope, is what people will do when they come to our classes. So whether it's for prevention or treatment, we know nutrition plays a key role when they come to one of our classes that's based on blood sugar control, heart health, even just general tips like navigating the supermarket, because once you learn about, you know, how about saturated fats and their effects on your cholesterol levels, how do you go into the grocery store where there's millions or thousands of products in the grocery store, and how do you make the best choices? How do you know a whole grain is truly a whole grain? We live in a world that our environments make choices very difficult, or the right choice very difficult. So hopefully by coming to our classes, we can at least, you know, help inspire, teach 1 or 2 tips. You'll leave with many more tips if you're paying attention the whole time. But even, you know, to apply the skills, navigating the supermarket, reading a nutrition label. So that's...
Let's talk about that for a minute. We spoke earlier about some sweetening agents which people need to know about. We're not here to denigrate anyone or their manufacturers, but I think that you as professionals, I'm sure, must talk about some of these ingredients. So let's start talking about it. Go ahead, Carl.
Well, the topic about sugar is very extensive, and I'd like to always focus on really reducing the amounts of added sugars. So whether it be in milk or yogurt or the jelly cereals that consumers are buying, is always identifying how much sugar or where the sugar source is coming from. So going straight to the ingredient list will always be key, because the total carbohydrate amount on that label reflects all the different types of carbohydrates: starch, fiber, and sugar. And so to really determine how much sugar it has added, reading the ingredient list would be the best. And there's probably 100 names for sugars. So it's tricky to identify them, and we go through them in our classes. But usually the most common ones, for example, will be the high fructose corn syrup, anything derivative from sugar, from corn, will be a type of sugar. Other types will be the sugar alcohols, anything ending on the word OL, that also has an effect on blood sugar and on weight. And just identifying these can help the consumers a lot. One of the tips that we give in the classes is to choose plain products. For example, plain yogurt, unsweetened milk, unsweetened teas, and if they need, then add some honey, some fruit to give it a flavor. But the goal is always to reduce the amount of added sugars.
You know, one of the things that was brought up in a show about a year ago, we're talking about labels, food labels, and of course they're required to put in by content. In other words, if the greatest percentage is whatever, wheat, protein, and then the next one is whatever it might be sugar, it might be something else, it's by weight. And people look at those first few items and they figure, well, I read the label. But it isn't that. What you're saying is, for example, there are products that are sugar derivatives, or they are what I call twins of sugar, because the metabolic reaction of the body is to the fact that they are sugars, alcohols. And what happens is, because they're way down on the list, that doesn't mean that they don't really have the elemental issues that relate to the prevention of diseases.
Especially when we're talking about portion sizes. So it might say that a particular product has however many grams of sugar per half a cup. But in a cereal, I might eat 1 cup or 2 or 3 times the amount of the serving size. So that brings up the amount of sugar that I'm also eating in the product. So always tackling the serving size, portion size is very important. We're talking about reading labels and choosing your products, how much you plan to eat.
Was said before we started the show, I spoke about the fact with both of you about how most often a lot of the people that are in your audience are what I would call mature or old, like me, who are, I'm only kidding, who are used to listening and reading and otherwise. Not that young people don't, it's just that it's very difficult when people use 146 characters now to communicate with one another. But the incidence of diabetes, and I'm not talking about juvenile diabetes in young people today is frightening. And the inability to make the parents or the significant guardians or others to understand that these children are putting themselves at risk, because I think for the very first time there are indications that our lifespan is either level or possibly, don't know yet, possibly might even be a little less than it has been for what we are now. And a lot of people attribute that to inappropriate diets.
So even though we may get more of the mature audience in our programs, in reality we do have a variety of ages, and sometimes we are surprised to see how young some of the audience members are. But nutrition doesn't have an age to it. So whether it's a kid that we're speaking to in our summer camp programs or our regular programs focused on a chronic disease such as diabetes, we got all spans of ages, and they may be there to learn for themselves. They may be a caregiver and learning to take care of their husbands or spouses or their children or grandchildren. So the information that's relayed can be applied to different stages, it's independent of age. But it's things that are just very important. It goes back to the plate that Carla brought back. Are you eating enough fruits and vegetables every day? Are you balancing the 5 food groups on your plate? Are you eating 3 times a day? It comes back a lot, whether we're talking about heart health or diabetes, whether it's prevention or management, these basic nutrition truths. And sometimes we have to focus on the basics a lot in our class. Another big basic is, can you identify a carbohydrate? So just whether you have diabetes or not, whether it's for weight management, for heart disease, we know complex carbs that have fiber and the importance of fiber in the diet. And it really comes down to, can you identify carbohydrates, your grains, your whole grains? And then can we work with you to reduce the carbohydrates that shouldn't be high in the diet, which Carla already spoke about, which are the added sugars and all their deceptive other names, syrups, the point is sugars. So that's focusing on one of the 5 food groups, but it comes back to nutrition basics, whether we're talking to someone young, someone mature, about this chronic disease or that chronic disease. There's definitely a skeleton, there's that foundation of nutrition that if we feel our audience needs to focus on that foundation, we'll focus on that foundation during the class.
One of the things that just runs through my mind, I'm thinking back to various shows that we've done, and whether they were sports medicine shows or whether they were cardiovascular issues or whether they were neurologic issues, we always speak about hydration. So let's talk about hydration. Tell me what the average, what should be, because it's not on your plate. It's somewhere on the table.
True.
So tell me about hydration.
So for hydration, I know that there's several guidelines out there that say 8 glasses of water a day, but I really like to always motivate the participants to look at the color of their urine. That's really one of the best or easiest tools to really see the hydration status of each person, because it varies. I might not need 8 glasses because I'm more active. I might need 10, 12, 14. But by looking at the color of the urine, you can really determine if it's a dark color, I need to hydrate more. If it's lighter color, like an apple juice, then I'm correctly hydrated. But going back to hydration and weight, for example, there's a little interesting fact there that some people, when they're dehydrated, the symptom is that they're hungry. And so they go grab a snack, they go eat, and they add up the calories, when in reality, all they should have really done is drink a glass of water. That's why sometimes you'll hear the advice, before you sit down to the table to eat, have a glass of water, because it might bring down or increase your satiety level. It might just be that you're dehydrated and needing some water instead of eating some food. So I always find it interesting that how water and still food, they go very much together.
Well, and again, I'm not going to get into the proprietary issues, but water is not always water the way the water should be consumed. There are different styles of water, different types of water, but you're talking generally. In other words, if you take tap water or bottled water, that's what you're talking about.
Absolutely.
All right.
Leaving aside the sweetened waters.
Right. I would just underscore what you're saying. I mean, hydration should be somewhere. Maybe you add another little circle there, because that glass of water is very, very important at the meal. Correct?
Yes. And dehydration actually it starts at 2% water loss, which is just a couple pounds usually on a typical weight person. So it's just losing some pounds, whether you've been exercising, like you said, in Florida, we may be sweating more. That's definitely one way to be losing fluids, especially if we're not consuming them adequately. But the main point is to avoid those sugar-sweetened beverages when you're thirsty and just go for that water.
Let me reflect upon something that, again, that I think we spoke a bit about before the show. You know, we have a new consumer view of food. It all started, I guess, with some of the, I don't want to mention the markets themselves, but they went to natural, in quotes, food, organic foods, et cetera, et cetera. But now they have sort of permeated the entire food chain, as I see it. Not necessarily in the restaurant areas, although there are many restaurants that make it very clear on their menus, a lot of good information that I think is valuable, that you as professionals would find to be available. But what's your view today about people shopping in that way? Or I would assume it's a blessing to your profession as nutritionists and dietitians to understand that people are focusing in on the value of food.
Absolutely. When it comes to the labeling of organic foods, it is a little bit tricky. So we try to educate always our participants into what that organic label stands for. Natural, for example, doesn't really have a legal definition. So some people might be spending a couple extra bucks on each product because it says natural, but when you look at the ingredient list, it doesn't really reflect very healthy ingredients that you really want to be bringing back home. But in general, the consumer that's looking to buy organic products, it's because of health. They want to reduce the amount of toxins, the exposure to toxins that they're consuming on a daily basis. And there's a list out there called the Dirty Dozen, and that focuses on really the foods that have the highest amounts of pesticides and toxins in general. And one tip that we always like to give out is to really focus on the foods when they have a skin, for example, to remove the skin, or different fruits or vegetables. That's a way to reduce the amount of these toxins without necessarily going to buy organic. It really depends on the consumer, obviously, the reason why they would like to buy organic, if it's for health, if it's for the environment. It does have several benefits, not just for health, but like I mentioned, for the environment.
We're down to the last 2 minutes of this show, and I want to give you both an opportunity to talk about the Baptist Health Community Health Outreach, which you're part of. So it's up to you. Go ahead, Lucette. You're on.
So Baptists, we care about our community. So one of the main ways we're in our community is through our community health education programs, like we mentioned. So we definitely invite everyone out there, if they have even the slightest interest or question in nutrition, to come to our nutrition programs that are led by a registered dietitian. We are, the most educated professional out there when we have those credentials, the RD and the LD. Some may even have additional credentials and specialties, but the main thing is I'd encourage the viewers to get their nutrition information from a registered dietitian. And luckily at Baptist Health, there's many of us that are all around, whether it's Carla or myself, and we'd be happy to provide information to the community.
Carla, how does one get in touch with you or Lucette or your program so that maybe they want you to come out to a retirement community or to a community center or to a city community center? How do we do that?
Well, our website is www.baptisthealth.net/wellness.
That's long.
It's a little bit long, but just if you remember baptisthealth.net/wellness, that's where we have all the schedule for our classes, nutrition classes, exercise classes, anything that we're providing for the community, they're going to be listed there in order of by date.
Are you based only in Baptist Health, or do you come out to the community?
We come out to the community,
right.
Broward, Dade, anywhere. We go to senior centers, Boy Scouts, Girl Scouts.
That's good. Well, again, we're down to now the last 15 seconds of this show, not 15 minutes. If it was another 15 minutes, I'd have to get up and let you do the show. But I would say to you that I'm very pleased that both of you are here. Again, I don't time date the show, and I know this is some so-called holiday season, but I think that everybody, every day is a holiday if you eat correctly and take good care of yourself. Because you mentioned it, wellness is the word for the future. In order to be healthy, you have to understand wellness. And a good portion of it is your intake of foods. So we thank you very, very much, Carla Duenas. You have multiple titles, but I'm very pleased that you're here as an expert on nutrition and dietitian issues. And of course, Lucette Telemas, thank you very, very much. Again, a highly educated professional in the field of dietetics and nutrition. We appreciate you both being here. And we want to thank the Baptist Health System for allowing the community to have a focus on eating healthy, because eating healthy means you're preventing disease, correct?
Yes.
Absolutely.
Right. So as I always tell you folks, that you give me the privilege of coming into your home, but I'm asking you to take care of yourself. So communicate with your healthcare professional, communicate with your doctors, read your labels, as these nice people have been telling you, because a lot of your destiny relative to your health is in your hands. So take care of yourself. Remember, this show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.